Good morning, Council President Hucker and all of the council members who are assembled today. Just a quick update based on my notes from my meetings with the team and or the Maryland Department of Health. Mr. O'Donnell will walk us through the update for the vaccine planning and the tremendous work that we did during the past week in administering the doses that we got. I remind the council that we received at our local health department sites 13,200 doses, but we received almost 40,000 doses in the county. And Mr. O'Donnell will walk through those sites in those areas and the great work that we did, not only with our Montgomery County public school partners, but also our community partners. And thanks to the community for supporting us. It was a tremendous effort in seeing the vaccine administration with our 5 to 11-year-olds, and especially when those children, those school-age children were upset, the community clapped and encouraged them as they received their shot. So that was a tremendous show of support and a great sight to see. I remind all that we are in flu season and we continue to host flu clinics. Flu clinics for the remaining month of November. There's one this week at our Dennis Avenue Health Center for ages 6 months to 18 years of age at 9 o'clock, from 9 o'clock to 3 p.m. And I can post these on the website. Our flu clinics are posted. Information is posted on our county website. Again, on Monday, November the 22nd, from 1:30 to 4 p.m., we host another community site, flu clinic at our Kennedy High School for ages 3 to 18 years of age. And then again on Monday, the 22nd, we have another site at Rockville, same age as 3 to 18 years of age. And in Seneca Valley, again, so we have 3 high schools who will host community level flu clinics then. Now, there were some community concerns brought to my attention as part of our vaccination effort last week, and I want to ensure all that we continue and we have ongoing education and training based on the Maryland Department of Health and CDC's guidelines for administering pediatric vaccinations. We are not wasting any doses. We want to get all the doses and shots in arms. And so I wanted to be upfront and transparent that we have trainings ongoing with our team. And as we onboard staff, our clinicians have been great in adhering to the guidelines. There was also a concern about transportation or lack of transportation and access at our Germantown site. And we followed up and had conversations with our MCPS and community partners to continue to create spaces where we have greater access to those individuals who may need public transportation or some other means of transportation to not only get themselves, but their families to our community-led sites. We continue to remain in moderate level transmissions, and we've updated our slide. Mr. O'Donnell will indicate where we are, and we are on day 5 of the 7-day off ramp as updated and amended by the Board of Health's Council's action last week. There was also a question about along those similar lines about the efficacy of mask wearing, and we work with our EPI team and our research team, as well as with our public health advisory team to provide those data points and what the science is saying regarding the efficacy of wearing masks in workplaces, schools, and indoor settings, but also the importance of wearing masks during how mask wearing last year, you noted, decreased the rate of community spread of influenza. We know that we are in flu season, and I indicated those flu clinics in my opening remarks. And so we know that that's an effective measure as well. And then lastly, we continue to work with our community partners. I know Council President Hucker, you mentioned and referenced some of those elementary schools. And so we have identified those elementary school settings where our community partners will support us, as well as shelters and other places that our MCPS partners and our non-public school and independent partners are unable to access. And I'll just identify some of those for as part of an update. So looking at our shelters and providing those pediatric vaccines and vaccinations in our shelter spaces, but also for those individuals who may be at home, who may be immunocompromised or have chronic illnesses and are unable to get to one of our community-led sites. So even their primary care provider or pharmacists. And so we also will have our community partners to administer doses in other settings, such as our Middlebrook Mobile Home Park, Clopper Mill Elementary School, Daly Elementary School, Beers Mill Elementary School, Lake Seneca Elementary School, Twin Brook Elementary School, and Burnt Mills Elementary Schools, Fairland Elementary Schools, and lastly, our Poolsville Elementary Schools. And so some of those are settings where, in addition to our community partners, our Montgomery County partners, that public school partners, where we previously used the hub and spoke model, we have expanded that, and we continue to evaluate our practices to make sure that we continue along a range of increasing equity, and access to our counties. I'll stop there and I'll turn it over to Dr. Stoddard or Mr. O'Donnell for their opening remarks.
Sean, you can go ahead first.
Good morning. I'd like to just share some of the updates that Dr. Bridgers had started us off with. And I will share my screen in just a second. So, as Dr. Bridgers touched upon, we have been we've been holding fairly steady right along the moderate transmission line over the last week for community transmission, and we have remained in the very low level of test positivity. We are now looking at, as we've been tracking along with our percent of all county residents vaccinated, we expect that over the next few weeks, the population with at least one dose will begin to go up as our younger populations are now being vaccinated. And then within a few weeks, we'll start to see the fully vaccinated numbers go up. So we'll continue to track that. And we've been working with our epidemiologists and our stats folks to try to break some of these down into including some of the younger age groups as we go forward. There has not been much change, again, with where we have lower vaccination rates or with our breakdown of vaccinations by race or ethnicities. Those have continued to be very similar to previous weeks. So this part of the Pulse report is an example of where we have broken out some of the younger age ranges to be able to look at what's going on with community transmission. And because we're breaking this out into smaller population groups, we are likely to see greater volatility week to week in these numbers, or even day to day in these numbers. So we are still seeing a higher transmission rate with our youngest non-vaccinated populations, and we're hoping those will begin to come down again as we're getting vaccinations out to them. We're still seeing a slightly higher rate in case rates in our Hispanic populations versus our non-Hispanic populations. Just a reminder here, I know we've been looking at rates that are around 50 per 100,000. That's a weekly rate. These are 4-week rates to try to, again, reduce the volatility between the data. So when you divide this by 4 weeks, you still see that these rates are fairly close to that, the number we've been trying to get under to get to moderate transmission. We are now seeing that slightly more than half of our cases are breakthrough cases at this time, but it's still a disproportionate number of cases and hospitalizations attributed to our non-fully vaccinated populations. The county is, our amounts of vaccine, as you can see recently, the amount of vaccine the county is administering has gone up quite a bit with the boosters. That is the purple lines here. And especially as we got into the Moderna boosters, where the county did a lot of its early vaccinations. Those folks have been coming out. It does take a little while to get this data into the chart. So we'll start to see in future weeks, we'll start to see the vaccinations we're doing for the pediatric populations. Our testing levels have stayed fairly similar, around 4,000 tests per week by the county itself. And then all providers still have a fairly robust testing capacity. We do expect as we get closer to the holidays, we'll see those numbers go up. So to give you just a slight update on the initial pediatric rollout, on Thursday, the county began doing pediatric vaccinations. We began with our 3 county community sites. And then we did that again on Friday. Over the weekend, we did 6 school sites on Saturday and 6 on Sunday. There was tremendous support from Mcps. They helped us in making appointments with families who would otherwise have difficulty making appointments through the electronic system. They helped to distribute appointments, a set amount of appointments out through each cluster of Title I and focus schools. And they showed up with volunteers and staff to support our efforts. Really, really appreciate everything they did. We also are planning to do, along with Holy Cross and some other partners, up to 13 more school sites during the week. The number of children we've done so far in the 5 to 11-year-old age range is almost 8,000. That actually doesn't include numbers from yesterday, so I'm sure we're over 8,000 at this point. We've also allocated doses to our safety net partners, just more than 1,000, and we have a number of clinics to use up the rest of our vaccine, likely by Thursday. We're continuing to do our pediatric clinics during the week in the evenings. And again, as I mentioned earlier, there's a number of MCPS sites we'll be doing at elementary schools throughout the week with our partners at Holy Cross. We have asked for another 20,000 doses for next week and 20,000 for the week after, and we're still waiting to hear on what the allocation will be made. The state gets a total number of doses allocated to them, and then they inform Pfizer and the federal partners how they want to split that up across the state. I believe those decisions are made on Wednesday evening, which will put us pretty close to the weekend for potentially receiving vaccine. We're hoping we'll get it in on Thursday, but it's, again, we're kind of beholden to that distribution network that's happening at the federal level. And then I know this has been brought up with a lot of the discussion about the mask mandates and lifting the mask mandates. Some individuals have asked, how much does the mask contribute to reducing disease transmission? And people have bluntly said, in areas that don't have mask mandates, you see COVID transmission rise and decrease, similar to what we have seen. And we've looked at it with our EPI team. We do know that the CDC has looked at a number of studies in the country and internationally to look at the data. And these studies continue to be published because certainly there's different settings that masks are being used, and potentially the way they're used in those different settings, whether it's schools or workplaces, can have an impact on it. Also, we know we've had different phases of this response that have included the increase because of the Delta variant. But just wanted to remind everyone that the reasons that masks are important is because we have, it's not just symptomatic individuals who are spreading COVID. There's also asymptomatic, or those individuals before their symptoms become clear can spread COVID. Additionally, it's not just unvaccinated people spreading the disease. We know that with the rise of the Delta variant, breakthrough cases also rose. Even if there is not as significant disease transmission or illness with vaccinated people, they are still spreading the disease. And of course, not everyone can be vaccinated, and even some who are vaccinated are immunocompromised. And so, wearing masks indoors help to limit that spread of disease. And a number of the studies that have really looked at this, looked at use of masks in lots of different settings, all agree that this is an important component of it. To go back to that point about locations that potentially have some different factors, on our county's website, we do look at jurisdictions that are similar in size and nearby us, including the District of Columbia, Fairfax, Baltimore City, Baltimore County, Anne Arundel, and Prince George's. And this chart here that you can find on our data dashboard, Montgomery County is in the light blue, and you see the other jurisdictions that are very close to us have some other similarities. They're in the gray, and we all have similar peaks and valleys, but you can see from the time where Montgomery County's vaccination rates really started to increase, we have consistently been at the bottom of those curves. And we believe that it is a combination of the high vaccination rates, the high adherence to masking and other social distancing directives that residents of our county have taken to heart, and the increased use of testing to both identify disease paths in symptomatic, as well as the asymptomatic testing that individuals are doing. So it is very, very likely it's these multitude of factors that are contributing to our lower disease transmission rate, and why we see these differences between Montgomery County and some of the other jurisdictions. And then finally, it's just a reminder that the CDC's recommendations is still that anyone 2 years of age and older who's not fully vaccinated should wear a mask at indoor public places. And that also includes a recommendation for those who are immunocompromised when they're indoors. We know that the recommendation, there's been a lot of discussion about this, and the CDC recommends, because of the Delta variant, if you're in an area of substantial or high transmission, that masks are recommended to help control that transmission. We've seen our transmission rate come down here during the mask mandate. And then finally, you're still required to wear them on public transportation when you're indoors, as well as when you're in schools or on school buses. So those are the CDC recommendations based on all of the scientific literature that they've evaluated. Happy to answer any questions about these that the council may have.
Good morning. I have just a few additional comments to add some additional context to what Dr. Bridgers and Mr. O'Donnell have already provided. So first off, since the council has last sat as the Board of Health, we have had quarantine guidance changes from the state of Maryland to the Maryland Department of Health, Maryland State Department of Education. In consultation with the Montgomery County Public Schools, as well as the team from Department of Health and Human Services, there were recommended changes to the MCPS quarantining guidelines that did take effect yesterday. A couple of things I want to note about that, though. A lot has been made of this test to stay protocol that we've talked a lot about. Right now, given what the changes that we've made to the quarantine policy, whereby lower risk exposures wearing masks who participate in the screening testing program are automatically not quarantined. The only category of students left who are quarantined are those who participate in higher risk activities, including consumption of lunch without a mask on, which the Maryland State Department of Education and Health guidelines clearly indicate, based on their guidance, is not appropriate for test to stay. Now, while we locally tend to disagree a bit with the guidance in terms of believing that we could proceed with a test to stay protocol, at this point we're trying to balance out the changes that have already been made with the guidance that we're receiving pretty clearly from the state. The test to stay for unmasked exposures is they don't view it as appropriate at this point. We'd hope to see them change that guidance to allow us to proceed with the test to stay protocol for the lunchroom exposures. But at this point, given the guidance and given our want to be not less strict than the guidance that the state is providing, then it sort of puts us in a really difficult position. So I did want to talk a little bit about that because there's been a lot of discussion about test to stay generally. That said, we expect there to be a significant reduction in the overall number of quarantined students in our school system as well, given the changes that we've made to the mass screening program, testing students not having to quarantine at all. So hopefully that will result in a significant reduction in and of itself. We did have a meeting again with the non-public schools on Thursday to talk through both the test to stay guidance that we had provided, as well as the new Maryland State Department of Education and Health guidelines. The non-public schools are not governed in the same way the public schools are by those guidelines and by the requirements of the state. They are generally free to operate within much more limited or much broader confines than the public schools are governed by the boards of education at the state and local level. So we provided them guidelines and feedback on what we thought was reasonable and safe, and answered many of their questions. And we think that we have been able to really clarify a lot about how they can proceed safely with different activities and changes to their quarantine protocols as well. The last thing I want to note is the Office of Community Partnerships has been heavily engaged in the education effort related to the 5 to 11-year-old vaccination. They have developed flyers in 7 different languages and are distributing to families. And a big part of their push is the fact that the county is receiving approximately 1/3 of the total doses coming into the county. And so people thinking that signing up or looking for county-only opportunities are missing a great source of other vaccine through the pharmacies, pediatricians, and other sources. And so we have to educate people about the fact that the county itself is only receiving 1/3 of the total doses. And so if you look myopically at just the county operated sites, you're missing a greater portion of the vaccine. And so we want to make sure people understand that, and that looking at these other opportunities allows them, to potentially get an appointment faster. And so it's just such a key point. If we receive more of the vaccine as a local government, we could, address more of their needs. But obviously, with it being such a distributed network, obviously, don't want them to miss opportunities. And so we've been educating them to that point. So I will go ahead and stop there, and happy to answer the Board of Health's questions.
Thank you so much to all of you. Council Vice President Albornoz.
Thank you. Just a couple kudos and then just a quick question. So my 2 boys got their vaccination yesterday at the Silver Spring Civic Building. Seamless, perfect. They played in a flag football game that same night. No issues. They went to school happily this morning. So parents that are out there that are hesitant for any reason, please just strongly consider moving forward and not holding back, not waiting. We know that more dosages are coming. But you can sign up for appointments now that may take a couple of weeks for them to be met, but you can sign up for appointments now. And speaking in the first person, but we just have my 5-year-old daughter, Teresita, left. She will be getting hers next week. And so we're thrilled. My parents got their booster shots 3 weeks ago. Again, no issues. They're doing terrific. My wife, who's a teacher, got her booster shot yesterday. And the moment that I'm eligible to receive my booster shot, I will as well. And so just please, to our public, continue to do what we've been doing all along, which is really important. Just a couple of questions. The sense that I get, and this is somewhat organic, is that there isn't the kind of hesitation among parents that you're seeing in other jurisdictions, which is in line with the county's really outstanding performance. Just wanted to hear generally, are you all sensing the same thing based on data and analysis? Is this what you were hoping for in terms of the projections of how many folks have signed up? And if we maybe compare that to our teenage population and adolescent population, are they in line? Are they congruent? Or do we need to do some more work to educate parents?
Sure, great question, Council Vice President Albornoz, and I'm sure Dr. Stoddard and Mr. O'Donnell will weigh in as well, because we've all been monitoring this. When we began to craft our plan back in July, we thought about any correlations from our 12 plus population, as you indicated, based on our 5 to 11 population now. And so in looking at that, we knew that during the first week, we saw a slight uptick, but during the second week, which is what we're in now, we saw our highest vaccination period, and we are anticipating that now. Unlike that period, most of the doses went to our community partners, our healthcare, and our pharmacy network as well. But as Dr. Stoddard indicated, The county-led sites are only a third of those pediatric vaccines that are available. Our healthcare providers, our pharmacies are receiving them as well. As a matter of fact, we've updated our website, or will update our website today to include the additional pharmacies that we have listed based on the updated list that I received from the Maryland Department of Health. Now, we're also looking at the data points as well, as we've always done through these past 20 months. We know that the Maryland Department of Health will develop, or should have developed by today, or we anticipated yesterday, a data dashboard. But we're also looking in PrepMod to see if there are any upticks either in our pharmacy spaces or in our healthcare spaces or in Immunet to see where those doses are. Now, I know that Councilmember Friedson asked during one of the previous Board of Health if there was a pre-registration model, and unlike the previous vaccination strategies, we have more partners involved, and so we have greater access again. So we encourage y'all to look at those websites, to make those appointments as you indicated, and so we can get a better sense of the need and access. During, again, one of our Board of Health discussions, we talked about demand and it being Groundhog Day. And we know that while the demand is high and that the county-led sites are receiving just a small portion of those vaccines, we hope that those other spaces will support those individuals who make appointments. And we just ask all to be patient. We've requested, as Mr. O'Donnell indicated, 40,000 doses for the next 2 weeks. Now, we don't know where those doses will land, but at our local sites. And so that will make a significant number of individuals who have gotten vaccinated. And so we continue to monitor the data. We continue to look at those spaces, and we continue to look at and surveil those spaces where we see any hesitancy or any unvaccinated rate. So that's where we are almost 7 days into this process, or 5 days, I should say.
Great.
And Council Vice President, I think the informal pathways that we're all, parent listservs, social media, I wasn't expecting we were going to see hesitancy in the first several weeks. I do think there will be a certain point, even in every pool that we've gotten to, there's been a certain threshold we get to where we need to start convincing those remaining to get vaccinated. And I'm sure we'll get there with the 5 to 11-year-olds. I just wouldn't anticipate it being for the first 3, 4, 5 weeks potentially. If we look at what happened with the 12 to 15-year-olds, we did approximately 50% of the individuals over the first about, a little bit less than 2 weeks. And then it was about, maybe 10% each week thereafter. And so it's that's roughly how it played out. And so we got to 50% in that population very quickly. And in this pool, that's 50,000 vaccinations. And so that's probably 2 or 3 weeks of vaccination. And maybe we'll start to see a slowly diminishing level of return thereafter, and we'll have to start working more to get the people in after that point. But I don't think we were anticipating there to be any sort of shortage of people to receive shots, at least for this first several weeks.
Got it. That's super helpful, and I appreciate that context from both of you. I also want to thank you. This past weekend, the Middlebrook Mobile Home Park was a joint partnership to be able to get vaccinations out to that community, which, as we know, was disproportionately impacted, especially early on. Great partnership and alliance. I would encourage you guys, though, as we've done in the past, to really partner with our primary care clinics to provide them with dosages more so than, I know we're limited in what we can provide, but flyers are so helpful and important. But as we know, for a significant percentage of our population, flyers alone are not going to really be able to break through in a way that we need it to. So, and these primary care clinics, Caseman Clinic, Mary Center, others are uniquely positioned both with their health promotores and also their longstanding relationship within communities and partnerships to go well beyond what we as a county can do on our own. And as we try to educate, and they also have hours of operation that are more expansive generally, and they offer weekend hours. So there's more accessibility there. So in these next couple of weeks, I know we did that in the past through the partnership with Por Nuestra Salud y Bienestar, as well as our African American Health Program and our Asian American Health Initiative. But I think as we get more, it would be wonderful to direct some of those to those clinics because they can go deeper, as we did within the mobile home park. So thank you all so much. I yield back to you, Mr. President.
Thank you, Council Vice President. I had a similar experience getting my 7 and 10-year-olds vaccinated this week. It was a big relief. It was nice to hear them hop in the car and Dr. Bridgers say, hey, good news, Dad, we can get vaccinated at Rolling Terrace, because they know I've been a broken record about this. So they had no side effects like the Council Vice President's kids, and would definitely want to pile on encouraging parents to jump in and get their children vaccinated. Council Member Glass.
Thank you very much, Mr. President. And I too have been overjoyed by hearing stories of colleagues and constituents who've been getting their kids vaccinated. And over the weekend was scrolling through everything on all the social media platforms and just really excited at everybody being really excited. And so again, kudos to all of our teams for rolling this out in an efficient as possible manner. And, Council Vice President Albornoz was just referencing the Middlebrook Mobile Home Park, and I too received a readout about those efforts up there, and want to commend everybody for going into the community, right? The lessons learned from earlier this year and starting off in that way. And one of the stories that I was told that is telling and something for us to be mindful of, that there was a little boy who was there with friends and some friends' parents, and he was excited and wanted to get vaccinated, except his mother wasn't there because his mother was working one of the 3 jobs that she works to provide for him. And so as we go into some of these communities, the Title I schools and other underserved areas, I think we need to be a little creative in adjusting to some of the unconventional but real job schedules that parents and single parents have to do to accommodate their kids and take care of them. And so I'm not sure how that's being factored in aside from Saturday and Sundays, but clearly parents work whatever they have to work. And I don't know if anyone has comments on that, but I wanted to make sure that I expressed that in this conversation. Duly noted. Good. So moving on, the other only question I really had was picking up on a conversation that the HHS and Education and Culture Committee had last week when we were talking about schools and the how we are doing this rollout. And I appreciate in this presentation sharing all the schools that we're going into and serving. The lingering question I had about that time, and we're not having the conversation with MCPS about their chief health officer, their chief medical officer position, which has gone unfilled. But at that conversation, I had raised the point that while we and the county side are undergoing a hiring process for the chief health officer, was curious if that process would allow us to share some individuals who want to help promote public health and help promote the coordination across county governments, since MCPS wasn't finding what they were looking for. Have we gone back to our consultant to see if the resumes that we've collected can be shared with MCPS?
Sure. Good afternoon, Council Member Glass. Is actually morning. Good morning. And Dr. Stoddard may have some additional information, but I know my conversation with Dr. Kroll yesterday, I know that he had a conversation with Dr. McKnight and their search committee, and I know that he has provided some additional information. I can't say particularly whether or not he actually forwarded the CVs over to MCPS. I know that based on the county's search consultant firm that they use to identify those candidates, there was some challenges from MCPS and having access to that consultant resource. But I know that Dr. Kroll has had conversations with Dr. McKnight and shared some of those additional candidates' names as well as perhaps their information. That's what I know as of this morning.
Excellent. I'm pleased to hear that, because I don't think we need to have a redundancy of efforts here. And if we're going after similar, not exact, but similar style candidates, and one search is being more fruitful than the other, I think we need to collaborate or at least share some of that information. So I'm glad some levels of conversation and name swapping is being had. So good update. I appreciate that. Keep up all the good work. And Mr. President, I yield back.
Thank you so much, Councilmember Friedson.
Thank you. First off, on the flu shot, I did get my flu shot a couple weeks ago. It went flawlessly. Appreciate the health team's support on that. The only negative is we did a little public service announcement video. My old football coach noted that my arm looked a little less defined than it did in high school. So it was a little bit too easy to pinch, as he noted, because they did a zoom in with the terrific nurse who helped me out. So a little embarrassed by that, but other than that, I hope we encourage all of our residents to get the flu shots, because it's not just COVID, it's about broader public health. Also like to report that the Friedson family, my 8 nieces and nephews, not all are eligible quite at 5 years old, but they have had very positive experiences so far, and we're excited about that. It certainly has been a relief for our family, and just want to add our encouragement and my encouragement for as many families to get vaccinated as possible. And certainly the process has worked out well so far. We've gotten a lot of positive feedback from constituents who were concerned, but who had positive experiences. So thank you for all of those efforts. It's not just the health team, it's the partnerships that you have been doing with the broader community partners. And so certainly that has borne fruit, and I think it's working pretty well. So I just wanted to thank you for that. A lot of work to do ahead, a lot of folks that still need to be vaccinated to get to where we want to be, but I just wanted to offer my thanks and appreciation for that. Just a clarification on the Test to Stay program. We're obviously hearing a lot about this, related to MCPS in particular, although broadly as well. I understand how the dynamics of what you're saying, Dr. Stoddard, earlier, with how the Test to Stay program, has to change based on the state guidance. You can't go further than what the state allows. I will say it's been quite confusing. The community was told that this was imminent, that it was happening last week. I don't think there was particularly clear communication of where that was. So could you just clarify where exactly that pilot program stands? Is there going to be a pilot program? Has the state guidance changed the fact that you don't believe it's going to happen anymore, or is it?
Well, so the situation is that the way we had originally designed the guidance with the Montgomery County Public Schools is for when there was a mask exposure and the student or students was willing to participate in the weekly testing program, the weekly screening testing program, for lack of a better way to describe it, they would automatically be opted out of quarantines. And so we had originally planned to reserve Test to Stay for those unmasked exposures in like a lunchroom. We always realized that the high risk exposures, the ones where it's at forced exhalation, like music class, the state was pretty clear early on. But initially, the guidance in the new state guidance was unclear about how they viewed lunchroom exposures. We know that lunchroom exposures are not the most common exposure, but one of the more common exposure types. So we thought Test to Stay would be applicable in those settings. We got additional follow-up from the state last week saying, no, they did not view lunchroom exposures as qualifying for any of the alternate quarantining mechanisms, most notably Test to Stay. And so we had originally planned to do a pilot last week with the intention of using Test to Stay in that specific niche exposure category where kids were at lunch and therefore exposed. Now, we're still hoping that the Maryland Department of Health will amend their guidance or clarify what they provided to us to allow us to proceed with a Test to Stay pilot involving unmasked lunchroom exposures. We had planned to proceed with it, but when we got the additional follow-up from the state saying no, they didn't view that as appropriate, that gave us pause to initiate a program, given that very specific guidance to say no, they didn't view that as appropriate. So we are not moving forward. We're not launching the Test to Stay. That is not to say we're not ready to do it. If the state changes its guidelines, we'll immediately move to do it. But we, obviously we're, trying to follow to the degree possible what the state has laid out and what they've expanded to. We've gone as far as the state will allow us to go, but if they do change the guidance that they provide us on Test to Stay, we're happy to implement it for those unmasked exposures. I don't know if Dr. Bridges has.
And so just to add to Dr. Stotter's comment, Councilmember Friedson, I did have a conversation with Dr. Perry at MSDE and Dr. Chan, the Deputy Secretary of Health at MDH, and we talked about our strategies and looking at the modified quarantine strategies to include test to stay, the weekly testing, and the consistent and constant mask wearing. We presented our strategies that were based on the county's approach and working in collaboration with MCPS. And so Dr. Stoddard and Cole and I developed some additional strategies. However, the guidance came back from state as far as their particular guidance is being predicated on either the mask wearing or unmask wearing. And as Dr. Stoddard indicated, lunch was one of those high risk settings. And so we talked about some additional strategies to mitigate the high risk settings, such as lunch. And so we have been going back and forth, and we are hopeful that the Maryland Department of Health and the Maryland State Department of Education will consider our recommendations so that we can move forward with those test to stay guidelines that we've set forth that we know will further enhance our modified quarantine process. All that to say is that we've presented an alternative strategy that would fall within those guidelines, but be specific to the jurisdictions. And we know that the guidelines are recommendations that both the MSDE and MDH strongly encourage or recommend that our public school settings use. And so we presented some additional preventative measures as well as strategies to present to them. And so hopefully we can have a conversation. I also have followed up with Dr. Perry to see if she would be willing to talk to our MCPS partners as well as our independent and child care partners, just to hear their voices as well as their intent and how it applies to their settings. So that's kind of where we are with those modified quarantine guidelines. We will use 2 of the 3 modified quarantine, and we will come back to test to stay once we have heard additional or had additional follow-up regarding our suggestions.
Yeah, I appreciate all the work that's going on. I understand that you're reacting to what is happening at the state, and you can only do what is in your control and within your power. I am concerned. I will just be honest with you that the message that we're sending to the public has not been clear. It's really confusing. We've been saying for weeks and weeks and weeks that the test to stay program was going to be implemented, that it was a pilot. It was supposed to be implemented last week. It's now being changed. I understand, what you've shared with us today, but I'm not sure that we've communicated that as well with the public as we need to. And I understand that there are sensitivities here based on these conversations back and forth with the state health department and the State Department of Education. But to the greatest extent possible, I think we need to be transparent of this is what we want to do. This is what we are asking the state to do. Tell the public what that is. And then they either allow us to do it or they don't. I don't think there is as much appetite as there perhaps was previously with we're working with the state and we'll see where we end up. I think we have to tell them specifically what we are asking for. And then it's up to the state to say whether or not they'll accept it, because, I think we've been, setting the public up for, what is the expectation for weeks and weeks and weeks. And now, perhaps out of our control, which I totally appreciate. It's not your fault. But we are to a certain extent moving the goalpost, unfortunately, here on parents who have been expecting this for quite a long time. So to the greatest extent possible, I understand there's sensitivities. I understand there's internal discussions that only so much of it can be shared, but as much as can be shared with the public, to be as clear and accountable and transparent as possible. This is specifically what we want to do. This is what we're asking the state for. Ultimately, it's in the hands of the state of whether or not they will allow us to do it. We don't have the power to go beyond what they will allow, and then ultimately we'll stand by that decision. We can only do what we can do. We can only control what we can control. I just would highly encourage that, because I think there's a lot of frustration and confusion, and some of it is not on the county. Probably most of it is not on the county. It's on the fact that the state guidelines have changed, and we're adjusting accordingly.
Yeah, just as a general point, so I understand. We Dr. Kroll, Bridgers, and myself and Mr. DeAndrea from Montgomery County Public Schools got on a call after we saw the guidelines, and we were prepared to move forward utilizing test to stay in the examples that we provide where there's a lunchroom exposure, until we got some very specific directed guidance that says no, we do not view that as appropriate. We were prepared to I won't say ignore the guidance, but go beyond the guidance in its letter. But when we got specific directed messaging saying they didn't view that as appropriate, that was when we paused. And so just so we are clear, as you said, council member, and we'll make this more public, for sure, I agree with your point. We would like to implement a test to stay program for the unmasked lunchroom exposures. I think we agree more with the exhalation, the other higher risk activities like singing and wind instruments and things like that. We view that as a different category ourselves. It's just we didn't lump that lunchroom with those other categories. We put lunchroom as sort of in the middle, and we view test to stay as the reason why you're buying down that risk. So just so we're clear about what we'd like to do, we just,
I appreciate that. I respect both of your public health expertise, always have, will continue to, but the communication with the public of where this is and why it has hit a snag, I think is really important so that we can protect public trust, which is always fragile and which is the single most important currency that we have in this whole conversation. So I appreciate the work that you're doing on that. Just quickly on this related to childcare settings, this is another area. There's a lot of parents that we have heard from that would like to see guidance for a test to return or a test to stay policy in childcare settings. I know that childcare programs are licensed and regulated by the state. It's a different dynamic, so to speak. But is there any consideration that there could or would have some type of guidelines, for test to stay, test to return at the local level? Perhaps even just sharing the CDC guidance versus state guidance, and then local health department guidance on this particular area. Any thoughts of how parents who are interested in this could engage either locally or with the state beyond their schools?
Sure, Councilmember Friedson. Our team is working together to put talking points regarding that. We presented to state before regarding their modified, even before they issued the modified quarantine guidelines a couple of weeks ago, to less than the 14-day to 7-day, to getting a PCR test on the 5th day and returning it. So we're working on that now. As you indicated, the child care settings are, again, a unique environment where we look at those places or those spaces where, there's the consistent and constant mask wearing, except for lunchtime or nap time, or those times where individuals are adhering to the child's personal needs. And so we're looking at that now to try to put that together. Again, as Dr. Stoddard indicated, we followed up with MDH to say, hey, these are the guidelines that you set forth, but this is how we see it in our settings. And so we're waiting for them to follow up and provide those guidance. Unfortunately, I don't have them before me as far as follow up, but we are putting that together now. I just got a note from our team this morning while we were on this call that they're putting together the guidelines now and following up. So hopefully I can have that and send forward to council so you can have it for your constituents to have at a glance or be able to communicate that to them as well.
I think that'd be really helpful. Appreciate the fact that you're working on it. As soon as you have it available, if you could share with all of us, I think that would be of significant help. Thank you for all your work. We got to keep our kids safe, but we need them to be in school and in childcare settings for their social, emotional well-being, for their brain development to the greatest extent possible at any point at which it isn't risking their health or the health of those around them. So this is the single most important thing that you are working on, that all of us are trying to support you in. And so anything that we can do to help you, please let us know. And I do appreciate all of your efforts. And I just hope that we can ensure that we're communicating as directly and responsibly with the public on all the work that you are doing and all the efforts that you are undertaking, and provide us with the information that we can to share that with the public to the greatest extent possible. I think it'll help us all as we go forward. So thank you very much.
Thank you, Councilmember Rice.
Thank you very much. And so a lot of questions around the school system have already been asked. Let me just say again that I certainly understand the frustration when it comes to dealing with the state and us having a plan that we think is appropriate for our constituency, understanding that Montgomery County is very different from what we've seen throughout the state. But unfortunately, we get lumped in when it comes to what the state overall is looking at when it comes to risk. And so we unfortunately bear the brunt of that and what other jurisdictions may not be as successful in doing as we're doing here in Montgomery County. And so it's understandable from the perspective of a statewide initiative, but certainly something that's frustrating to parents here in the county. But unfortunately, that's the power struggle that continues to exist between local jurisdictions versus state jurisdictions when it comes to health policy in general, and many other policies that we have here. So really appreciate you continuing to go to bat on behalf of the school system and of the parents who want to keep their kids in school and think that we can do so safely. So just want to say thank you and appreciate the work that you're doing there. I did want to talk about our senior living centers and just ask a very quick question. We were very successful when it came to the initial work around vaccinating our residents, especially those who are have mobilization issues, can't get out and go into to get those boosters. Have we set up the same sort of structure that we did before when it comes to outreaching and working with these various senior living centers, those that are wheelchair bound, mobility issues, things like that can't get out, and actually having the boosters go to them? Have we been successful at doing that yet? Is that part of the plan? Where are we when it comes to that?
Good morning, Councilmember Rice, and great question. And yes, we are out participating in outreach to our senior centers, our assisted living facilities, and our developmental disability congregate spaces. We're also administering, we continue to administer any first series doses or third shots for those immunocompromised, and those boosters for individuals who are homebound. And so we continue to work with that. One of the opening notes that I didn't include is that we're working with the state again to look at those mobile vaccination capabilities in the county. We have our team working with them to not only identify those spaces that we continue to see based on our data analysis, at risk or underserved populations by zip code analysis or by our census tract, but also in those spaces where we know folks can't get out. And so we continue to evaluate and assess that. So again, yes, that has been factored in. It continues to be part of our equation, not only for our adult doses, but for our pediatric doses as well.
I would just ask, do we have a contact for if you are manager or director of a senior living center, one of these facilities, and have not been contacted as of yet or haven't, who should they reach out to make sure that they can set something like that up?
They can reach our support line, which is 240-777-2982, and our team will fill the requests. If we can't physically do it, we will provide a contact or a link to either a location or entity that can get there and can administer those either vaccines, those boosters, or in certain instances, those pediatric vaccines that we are administering now.
Excellent. Thank you very much. Really appreciate that. And for the millions that are watching at home, as Councilmember Dwando often says, there are going to be some folks who will definitely give you a call who definitely want to try and set those up. We have a number of them in my district, and I know we have a number of them across the county that are very interested in making sure that we get this done. I do want to close by just saying again what I heard from Council Vice President Albornoz, Council President Hucker. I received the Johnson & Johnson shot, received my booster at Germantown campus along with my mother. She did it early in the morning and I did it right after her in the afternoon. It was very simple, no complications. So for anyone who has received Johnson & Johnson, I got the Moderna booster and have had no health complications. I actually signed up for it. And I did want to highlight something for those of you who are getting your booster shots. Please sign up to be voluntarily a part of the study, which does follow up in terms of any kinds of health complications that you have. I participated in that. And so it gives valuable data to CDC as well as to, and I forget the name of the organization, Dr. Bridges or Dr. Stoddard, you may know it well, but they're actually the ones who are collecting that information about what my complications were. It started every day for the first week, and they asked about different symptoms, things that I had, and then it's a weekly check-in after that. But it gives valuable information so that when folks report about what side effects there are, all those kinds of things, they can be incredibly accurate. So I encourage folks to be a part of that. It's a very simple, painless process. There's only a couple questions. They send you a text message, comes right to your phone. You answer like 5 or 6 questions and you're done. And it's just that simple. But it is really important to make sure so that we can document and log any kinds of complications or side effects that people may have. Fortunately, I didn't have any. And so that goes into the report in terms of what it is they're doing in terms of recording all the different instances. But did just want to encourage people to make sure that they're doing that because it will be helpful in all of that data that makes sure that folks know just how efficient and safe these vaccines and boosters are. So that's it for me. Thank you, Mr. President.
Thank you. Councilmember Reamer.
Thanks so much. Quick clarifying question. I understood the charts, the presentation from the charts, that about half of our cases are under 11, under 12. Did I get that right? And then also that about half of our cases are breakthrough cases. So I'm sorry, I couldn't quite grab it as you went through the breakthrough, but is that right? That would seem to imply that half the cases, almost all the adult cases are breakthrough cases. And, generally speaking, again, I just wanted to emphasize, as you said, that we're optimistic here that as the under 12s start to get vaccinated, we're going to see case numbers coming down. And, perhaps there's a correlation there between the unvaccinated pediatric cases and the breakthrough cases, it could be, but could you just talk about that topic a little bit, please? Thanks. I'm not sure if I'm directing my question to Dr. Bridgers, Dr. Stoddard, or Mr.
Yeah,
O'Donnell.
I was letting him
So Donald was bringing it up, and so we will add to that narrative.
All three is good too. Yes. All right. Dr. Bridgers, okay. Could you say what you said, Dr. Bridgers? I think you were directing Mr. O'Donnell. That sounds fine.
Yeah. So again, looking at what we're seeing here, I wouldn't say that it's almost all of our cases are breakthrough. It's slightly more than half of our cases. And but as you can see, even for half of our cases to be attributed to unvaccinated or not completely vaccinated populations is quite a lot for a much smaller number.
We're not actually seeing the screen, or I'm not seeing the screen, or others. Yeah,
no, if you could, he's not sharing.
Share it again, please. I think it got unshared. There you go.
Right, there you go.
Okay. So again, the number, one thing about this is it's the way we are able to look at the data. And so this chart in the lower right here includes populations all the way down to 10 years old, which is why that percentage of not fully vaccinated is larger than our 12 and up percentage.
Of the 10 and of the older than 10 cases, then half are breakthrough.
Yes. So this is just looking at 10 and older. And so, yes, about half are breakthrough cases right now. So you can see again, it's still in the proportion of vaccinated to cases. It's a much smaller number.
So, right, exactly. So 3/4 of the cases are unvaccinated because half of the cases are pediatric, if I'm understanding correctly, and 25%. No, I don't want to make a mess of this. So if you can, there's an interesting topic here about breakthrough cases and what share of the cases overall they are. And then because some are asserting that vaccinations don't help that much. And, to me, it's clear that this virus is finding the unvaccinated. And that's what's fueling the drive. And I think a lot of the vaccinated breakthrough cases are probably related to unvaccinated cases, but we can't really prove that in this data, I think, but perhaps we'd see some effect as the youngest get vaccinated.
I think there's a few important things here to think about, council member. So you're looking at 10 and over, which in Montgomery County, that is a very heavily vaccinated population. And yet the unvaccinated are driving half the cases. And so I think that's,
it's finding the needle in the haystack. It's like, right. It's finding you wherever you are, it's going to find you.
And there are a few other big pieces about this. So I think the CDC just released an analysis that said, while vaccinated people may be fully capable of transmitting to other people, there are a few characteristics of that are still clear. Vaccinated people are, I don't know that there's any single super spreader event that's been, tied to a vaccinated case transmitting to a high degree. So certainly the high exposure incidents are being driven by the unvaccinated, and vaccinated people are 5 times less likely to acquire COVID than someone who's had a previous COVID infection. So natural immunity is not, it's not what it is often led to believe. I'm not saying it's zero. There's often this misnomer that says it's either as good as immunization or it's nothing. And it's somewhere in between there. And for different people, it probably means a different thing. And so there's this fallacy out there that, natural immunity is just as good. And there's fallacy out there that it's not good. It's good for nothing.
And some for whom it wasn't very good at all because they're dead.
That is correct. That is absolutely correct. And so in a county like Montgomery County, where, as we talk about with this graph, this is 10 and over, this is a heavily vaccinated population. 90, I know we argue about whether 99.9 is accurate, or maybe it's 97 or 95. Regardless, it's a heavily vaccinated population. Half the cases are still being driven by that narrow percentage of people who are unvaccinated, and 60+% of the hospitalizations are being driven by that narrow population of people who are unvaccinated. And so this clearly indicates that, if you took out that 61% and those 48% of cases because everyone was vaccinated, that would be a tremendous improvement in our community's health and further reduce that R number, which is the sustainability of the pandemic itself, that of the endemic version of this virus. If you took that number down substantially by getting rid of those unvaccinated populations, it would obviously make an even bigger difference. And so this data is pretty clear that, yes, you see breakthrough cases. Yes, you see breakthrough hospitalizations in rare circumstances, but this pandemic is still being driven by a narrow slice of the population who is unvaccinated.
Right. And just to add, Councilmember Reamer, our epidemiologist team just yesterday, and I haven't seen the numbers yet, have begun to drill down even further and to look at those subpopulations. So looking at those cases from 0 to 5 and from 5 to 11, as you indicated, where we may see either breakthrough cases or cases in that unvaccinated population by race, age, and ethnicity, to also include if there are any pediatric participants in any clinical trials and what impact that had on the larger population or have within that particular age bracket. And so we are, looking at not only the rates per 100,000 by age group, but also by race and ethnicity, and even breaking it down to where we see breakthrough cases in those populations. Also, what, as you indicated, what the impact may be in our school settings. And so we're looking at that now to see if that's impacting, has any significant impact on our quarantine strategies, modified quarantine strategies, if in fact it's disproportionately impacting that effort as we look at those either larger exposure categories or in any isolated cases. So that's kind of where we are with data analysis. Now, previously we had a larger resource at a glance data dive, but now we're looking at those cases as we continue to see cases. We had 66 today, and where there's deaths, is there any individuals who are in cohabitation with their seniors or grandparents and school age kids who may be affected, I should say. So that's kind of where we're going with the data analysis now, as Dr. Stoddard and Mr. O'Donnell indicated. And so we're trying to tease that out now, and hopefully in upcoming Board of Health presentations, we can present that narrative and data to you.
Thank you so much. So just a very big picture comment, which I'm sure it's on your mind, which is that, the waning immunity from vaccination means that we are going to have to keep up these efforts for a long time, because as the immunity wanes, then people are more susceptible to a breakthrough case. And at this point, we're fortunate that it's only the Delta variant that we are contending with, with waning immunity. But, we're going to be here 6 months from now and a year from now, and potentially far longer into the future, talking about how to keep up our vaccination campaign, because we've got nearly, we're going to be heading towards 1 million people who've been vaccinated, then with various stages of, waning immunity. So getting people to know when it's their turn, and then to come in and get that vaccination appointment, that's a campaign that's going to be here to stay. Last thing I want to say, I just wanted to thank you and compliment you on the pediatric administration of the doses. I think a lot of parents were worried that this was going to be like the early stages of the vaccination campaign, where it was really hard to get an appointment. Right now, it is not hard to get an appointment. Yesterday morning, I went onto the county website at 8 a.m. and I got an appointment for my son at 6:30 a.m. and he went in, he got his vaccination at the Silver Spring Civic Center. We went in there. It was almost, when my wife took him, I was making dinner, but she reported back that it was almost all kids, and it was a somewhat fun atmosphere. You're for the as others have said, for the parents out there, it's you can look forward to it won't be the experience in the doctor's office getting a shot, potentially. Like, it could be a more, go get an ice cream afterwards. But anyway, I'm so relieved that my youngest now has his shot, and we can have the whole family, on the same footing for, going forward. It's quite a relief. Thank you.
Councilor, can I add one piece of color to what you said, talk about the waning immunity piece. I just want to put a plug for one of our local companies, Novavax, who just entered in September a phase 1 clinical trial for a dual flu COVID vaccine that may be potential for use next year, for us to do boosters, where you can only you get one shot and you get flu and COVID-19 as a booster moving forward. So that's a promising way the technology is going.
That's awesome.
Thanks.
Councilmember Katz.
Thank you very much, Mr. President. And first off, so many questions, so many answers have already been given that I'm not going to repeat them. But I do want to thank everyone for doing all that you're doing. The system is working, and that in itself shows that you are you're doing it the right way. I did want to second what Councilmember Rice was talking about for our senior population. The larger areas, the leisure worlds, the villages of Rockville, the Asburys, and of course the list goes on and on. But if there is a possibility of setting up some sort of way that we can have the boosters closer to a person's home, I do believe that would be a way to be successful. Obviously, there's only so much people that can put a shot in someone's arm, so we have to figure out how you would do that. But the closer we can get to the people themselves of that population, just like for all other populations, I think that would be most helpful. And I do want to thank, though it's not in my district, I do want to sincerely thank putting as an example the mobile home park at Middlebrook. That really shows that Montgomery County is doing everything that it can do to get as close to the people that need the services as possible. And I think that's something that should not get lost in anything. I am impressed that our hospitalization rate is low, And that's one of the discussions that I've had with people. They say, well, I don't know why you're doing this, and I don't know why you're doing that. Your hospitalization rate is low. It has to be mentioned that the reason our hospitalization rate is low is because of what we're doing. And we're not doing anything other than to make certain that people are safe. So I think that has to be mentioned. And I do want to second, I believe it's Councilmember Friedson's statement about keeping things as non-confusing or as simple as it can possibly be. Though, of course, my arm still, is very muscular, so I wouldn't have had the same issues he had getting a shot. But the bottom line is, if we can keep the first lines of what we talk about as simple as we possibly can, as the executive summary type of thing, so that people are aware of what we're doing, and then go into all of the other charts, I do believe would be helpful to people. Some people will look at every chart and agree and disagree and whatnot. Most people just want to know where we are and how we're doing in general. So if we could keep that as simple as possible, there again, thank you all very, very much for what you're doing. It is not lost on any of us that this is not easy, but it's very necessary. And with that, I will turn back to you, Council President.
Sure, Councilmember Katz, one quick comment. We are returning to our independent living facilities, as I indicated before. We have them scheduled, and we are returning. And we have an appointment to administer boosters tomorrow at 2 a.m. So that's posted on our website. The other piece is to that.
2 a.m. or 2 p.m.?
2 p.m. I'm sorry.
Yeah, you said 2 a.m.
2 p.m. I'm a deadhead trying
that's when you might be up, doctor, but yeah.
To get things in order. The other piece is that we have daily conversations with our aging and disability service area to look at those spaces, because we are focused on pediatric vaccinations and boosters now, and we have a aging and disability service area who keeps us in tune with the pulse of the community, especially our senior population. So we often have conversations, and we have staff supporting our public health emergency planning team led by Mr. O'Donnell to advise us of those spaces where they may not have access to create an accessible space. So we will have the vaccination booster clinic tomorrow at 2 p.m.
Very good. Thank you very much. Thank you, Mr. President.
Thank you, Councilmember Katz. Just a couple follow-ups. Thank you. I'm so glad you're focused on the Title I schools, as we mentioned. I've heard a little bit that the appointments may be filling up with community members, and are you taking any precautions to make sure that the students at those clinics have the first shot at filling up the appointments?
Yes, we've been working with Montgomery County Public Schools to distribute out appointments with them, not only for the school sites, but also some of our weekday clinic sites. We send them the links with a certain number of appointments in it. We give them a few days to schedule those. Obviously, the very first day or two when we initiated Rollout, there wasn't as much time to do that, but certainly over the weekends we did that. They began by making phone calls to try to sign up families. They also distributed out through their principals, as we did with the 12 to 15-year-olds. So, honestly, there is a huge urgency across our county for people to get appointments. And as that urgency wanes just a little bit, we'll see better and better results of getting to the as many of the intended populations as we can. But we continue to share those appointments. I know right now we're in discussions with the schools about how soon we can send out appointments for this coming weekend. And one of our challenges is we don't want to sign up people for appointments and then not have vaccine come in time for it, because it can be very, very confusing to people. And so we're trying to balance the two. As soon as we have some sense of when we might get that vaccine, and we'll begin to share those appointments. And then after giving them a chance to sign up, we do expand the appointments and open that up to the wider community.
Just so that's clear, so the schools where they're being hosted get the appointments days at minimum hour, 16, 18 hours before they go open to the public. So they've already had an opportunity to sign up before anyone else has seen the opportunities broadly. And then whatever's left over for appointments, we share broadly. And that's sort of the mechanism. Okay, great. Thank you. I mean, it's obviously not the most important issue in the world, the hierarchy, because we want everybody to get vaccinated, but certainly we want to try to prioritize the intended folks. And it's great news that, as been saying, those are going to be really, I think, effective sites for getting higher adoption within the community. Councilmember Duano.
Thank you. I'll be very quick. As Councilmember Katz often says, everything has been said, and I won't say it again. But this was, I was very impressed with I have continued to be very impressed and thankful for the work that you and your team do, and how efficient the vaccination was. To Councilmember Albanaz's point, my kids were very happy with the vaccine. Actually, I think I have. I'll show a little proof here if I can. There you go. Thumbs up from with all the cards. And this was before ice cream. So just proof that it's a good thing to do. And the kids had a seamless transition, and the people were very nice, and they have stickers and a whole bunch of stuff for kids. So really appreciate the work you're doing. And thank you for the update on the schools. I want to thank Councilmember Hucker for bringing that up. I think that makes a big difference for a lot of families getting it where they are. So it's a good job. So thank you all, and keep it up.
Thank you. Councilmember Navarro.
Thank you, Mr. President. And I wish I had convinced my young adult daughters to take a photo like that with the thumbs up when they took theirs, but that was a gorgeous photo. Just really want to add to what has been said in terms of congratulating you for the efficiency and the strategic way in which you have been navigating this next chapter. It's, as we've always said, no manual. We have worked together to develop this as we go. And I think that so far, the metrics in terms of, case numbers, positivity rate, the rate of vaccination in terms of the eligible population, I think speaks volumes. And the most important part is that our kids are in school, and now we are so fortunate to be able to take advantage of vaccinations for them. And so it's that flicker of normalcy, hopefully at the end of the tunnel, as long as everybody continues to do what is important, taking the measures, the necessary measures, and getting the boosters and all of that. So it's just to say that, not an easy ride, but so far I think that you've done a very good job, and our residents just deserve so much praise for their patience and for stepping up every single time.
Agreed. Okay. Anyone else?
Council President, one more piece. While we've been on the call, Maryland dropped their numbers overall. So there have been 18,592 doses of vaccine given out statewide, ages 5 to 11. That means that 42% of the statewide total was distributed by the Montgomery County Department of Health and Human Services alone.
42%.
So, yes. So we're doing quite well relative to, not everyone's, there's been obviously more than 20,000 doses, almost 20,000 doses at the state level, but more than 40% of those came from our local Department of Health and Human Services. So I definitely very, proud and happy of the efforts they've undertaken.
Yeah, great work. And what a credit to our residents too. I know I received the survey from the school system asking whether I was likely to get my kids vaccinated. Do you know the results of how many people? I had seen it as low as 27% or something early on. I'm guessing it must be higher than that now, that wanted to get their kids vaccinated. Okay.
I haven't seen those numbers yet.
And we'll find out next week. As a reminder to my colleagues and to the public, MCPS is not here today because they have a Board of Education meeting, and they'll be back, of course, next week. So we'll dive deeper onto MCPS issues next week as well. Okay. Well, if there's nothing else from my colleagues, thank you all so much for your good work. Keep it up. This is a great step forward in this chapter, and we're looking forward to next week's update.
Thank you all. Stay safe, and there's still time to get a flu shot.